Hi, I'm Dr. Anna Baranowsky, and I'm sitting here speaking with Andrea Chetas, and she is a constable with Toronto Police Services. And I know, Andrea, that you've been exposed to a lot of trauma in your workplace, and that you have your own understanding of what it really takes to face that and to be able to function in that kind of environment. This is really for PTSD Awareness Week. And I know it makes a really, really big difference for officers and other emergency professionals to hear from somebody who's experienced life, facing trauma every day in your work. Can you tell us a little bit about that?
Sure. So I started with the service about 8 years ago, knowing full well what I was getting into, looking forward to being of service, and working downtown Toronto. Had some subsequent radio calls that were shocking and upsetting.
You were exposed to some pretty terrible violence and incidents that just, I know they really shook you up.
Yes, they did. Yeah, they did.
So what do you do with that?
What I did was I ignored it.
Okay, so you were burying it because
Yes.
the pain was pretty big.
And that's what we do.
And that's what you do.
Yeah.
So how did that work out?
Not so good.
Not so good.
No.
Okay. So what does work? What does make a difference? If burying doesn't work, what do you do to make a difference?
Well, what I've learned is that burying it doesn't work because it comes up again. So facing it, allowing yourself to think about it or talk about it, opening up to somebody about it, and kind of learning that you need to, or accepting that you need to learn how to deal with those situations.
It's funny how, it actually takes courage to do what you just described, to really face it, to share it, to make sense of it. And yet it's what people generally do is they bury it. So what you're doing right now and what you're sharing with everybody out there is something that takes tremendous courage. But I also think that it creates the opportunity for a lot of growth and gives you the strength to go forward.
I agree. I think that if you're going to go forward in a healthy way, and you want to have a healthy life, family life, be physically healthy, emotionally healthy, that you have to at some point stop and face it and find a way to deal with it.
Anything else that helped you kind of just face the stuff that you have to face every day? I mean, this is really for emergency services, policing, people out there who are facing trauma in the course of their work every single day. So what else works for you?
Breathing techniques.
Breathing techniques are really good. Yeah,
Yeah.
they can make a huge difference, can't they?
Yeah, it really does help a lot.
Yeah, because that stress reaction can be so incredibly sharp, and it doesn't just go away because you leave the scene.
No.
And then having a mechanism where you can really settle down your nervous system can be incredibly powerful. And again, thank you so much, Andrea, for speaking with us and allowing us to share this with others, because I know that it makes a huge difference for other people who are out there making a difference in their community wherever they are, and also raising awareness about the impact of trauma in the workforce. And again, I just want to thank you so much for sharing that.
You're welcome.
Thank you.
Thank you.
Yay! Okay, for more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.